Good evening, everybody. Good evening. Good evening. Hey, let's get to our seats and move to the front. Okay, let's all get seated and we'll get started here in just a minute. Well, that worked. Okay. Well, hey everybody, welcome. Progress report. It's great to see all of you once again. We appreciate the turnout and we appreciate all you do with us in our work over the past year. I'm Jeff Jones, and tonight my job is to be the host. For the past year, it's been an honor to lead the ASAP team. Your encouragement and support has been simply overwhelming, and I can tell you that we as a team are more committed than ever to get this job done. As we enter year 2, we know we can count on you for the energy and effort it will take to address this terrible crisis, which truly does affect everyone in the community. We're going to move pretty fast tonight. We're all scripted, but we want you to feel like this is a conversation with you. The program will be focused on the progress to date and the plans moving forward. I'll begin with a quick review of what's been accomplished during the first year and how we arrived at this point. Next, we'll share some exciting news with regards to funding, and then spend the majority of our time with the ASAP leaders discussing their progress and plans. And to wrap things up, we'll hear from 2 special guests from the state of Indiana who will offer their perspectives and an overview of the state's actions and plans. So let's begin by taking a quick look at where we've come from. First and foremost, I need to recognize our leaders for giving us a big head start. Without the alliance and collaboration between the City of Columbus, Bartholomew County, and Columbus Regional Health, the chances for significant progress would be very slim. Thanks to our 3 sponsors, Mayor Jim Lenup, County Commissioner Carl Lenup, and Columbus Regional Health President and CEO Jim Bickle. We appreciate your collaboration and your vision, and we are also grateful to Columbus Regional Health and the CRH Foundation for their financial support of all ASAP expenses during the first year. Without CRH's generosity, we would not be here tonight. Another big advantage we've had from day one is the guidance from the Healthy Community Council. This group of leaders is committed to the wellness of the community, and their advice and direction has been invaluable. I know that many of you are here tonight. Thanks to all of you. When the ASAP team began our work, it was immediately crystal clear that we were not capable of getting much done without the involvement of the hundreds of people who were already helping the women, men, and their families who suffer from this disease. Most of the knowledge we've gained has come from you. And I'd like for all of those in the audience that have met with us, talked with us, taught us, and worked with us on our teams to raise your hands. Okay. You are the experts. You're the experts, and I want you to know that we appreciate your dedication and your experience, and that we will continue to depend on you. We also recognized early on that a strong connection to the state of Indiana would be critical to our success. And that's why I'm so pleased that we've been joined by two senior leaders from Governor Holcomb's administration, Mr. Jim McClelland and Dr. Jennifer Warthall. Jim was appointed by the governor in January 2017 to the newly created position of Executive Director for Drug Prevention, Treatment, and Enforcement for the state of Indiana. And he's been running hard to every corner of the state for the past year and running hard in the State House. Dr. Warthall, who was appointed by the governor in January of last year as well, has the responsibility for the state of Indiana's Family and Social Services Administration, which serves millions of Hoosiers and includes the Division of Mental Health and Addiction, Division of Family Resources, and Medicaid Policy and Planning. Jen and Jim spent the afternoon with us and a group of community leaders, and it was a great opportunity to get better connected with the state and vice versa. We'll get a chance to hear from Dr. Warthall and Jim later this evening. Now I'd like to shift to the work. The past year has gone by really fast for us, and while I can't say we're having fun yet, it's certainly been rewarding. Once we were off and running, the team has not stopped listening and learning. This includes extensive research and visits to treatment centers, jails, courts, and healthcare operations in other communities. Near the end of last summer, we had developed a vision and gained approval to proceed from our sponsors and the Healthy Communities Council. By last October, at our 6-month progress report here at the Commons, we were ready to share the strategy for what we now call the Substance Abuse Support System. And over the past 6 months, we've developed firm plans and reached consensus with many key stakeholders and have begun the hard work to make the system a reality. Now I'd like to describe the Substance Abuse Support System, which is the foundation for the many solutions. The Substance Abuse Support System contains 10 critical elements, with these 8 clearly aimed at providing intervention, care, treatment, and recovery support for the men, women, and families suffering from addiction. Like any good system, the elements must work well together, and while parts of this system exist today, there are many gaps and inefficiencies. Each of these critical elements have been assigned a leader, project teams have been formed, and over 35 projects have been launched, with more to come. This is the hard work aimed at closing the gaps, adding capacity, and improving the effectiveness of the system. We also know that the system must be client-focused, and we've learned from many of those who suffer from addiction how difficult and complex it can be to find the help they need. We also looked at what other progressive communities have done to address this complexity, and as a result, we identified the hub as the 9th critical element. The hub is a resource center connecting people throughout the system, including service providers and recovery support programs. The 10th, and arguably the most important critical element, is prevention. We know the best way to prevent addiction is to address the root causes early and prevent it in the first place. We believe that everyone can get engaged in prevention-focused activities and that Bartholomew County can become the smartest and most compassionate county in the country when it comes to substance abuse and addiction prevention. So in summary, what the work is about moving forward is the building and optimizing of the substance abuse support system. And the ASAP team leaders will cover the details in a few minutes. But please don't assume that this system will ever be perfect. This is a very complex problem with many obstacles. There are a number of major gaps that will be extremely difficult to close, like housing, and significant variables that are out of our control, like insurance coverage issues, or worse, the lack of insurance. Also, I don't want to imply that the system stands alone. It must mesh with many other organizations and processes that already exist. To this point, I want to acknowledge the outstanding collaboration with our school systems and other youth-serving organizations, employers, social service agencies, churches and faith-based organizations, nurses and physicians, teachers and coaches, and many others. It's also important to recognize the critical role that the Bartholomew County Sheriff's Department and Columbus City Police Department play as key partners in many aspects of this system, and for their aggressive efforts and success in stemming the tide of illegal drugs. One final important point about the progress. While there are a number of potential sources for funding for the many projects, like state and federal grants, private donors, and business investments, I want to recognize Mary Ferdon for her leadership in establishing the newly created Substance Abuse Public Funding Board, which held its first meeting earlier this week. This board is a joint effort between the City of Columbus, Bartholomew County, and Columbus Regional Health, and was put in place by the Columbus City Council and Bartholomew County Commissioners. The board's mission is to provide accountability and transparency to our citizens on how public funds can be approved for substance abuse initiatives, and we look forward to making our case for several projects in the coming months. I hope this has helped you understand where we're at the end of year one, and when I say we, I mean everyone. This is the responsibility of the entire community, and it's hard work. However, everyone should be optimistic because we know this is a community that cares, and because we can help make the life better for our friends, neighbors, and family members who suffer from addiction. Which brings me to the reason why we selected "We Know We Can" as the aspirational theme for the work moving forward. We believe that this expresses community involvement and confidence and establishes a strong call to action aimed at solutions. All of our materials and initiatives will carry this theme as we move forward together. Thanks for the support over the past year. Now it's time for the ASAP leaders to share their progress and plans. But before the team comes on stage, I'd like to ask Tracy Souza, the president of the Heritage Fund, to help us celebrate an incredible achievement.
Thank you, Jeff, and good evening. I am joined up here on the stage by Mark and Wendy Elwood because, quite frankly, this celebratory moment would simply not happen without their participation. Mark and Wendy have been both thoughtful contributing members of Heritage Fund for a number of years. So let me now just say that it is truly an honor to share with you tonight that this community has raised over $1 million to combat the opioid crisis. You got a standing ovation. I can tell you there was such a great deal of excitement when Mark and Wendy approached us and said that they wanted to make a gift to help further the work of ASAP. And they said, well, we'd like to make a gift of $500,000. And we all thought, wow, that's fantastic. And then they said, if you can raise another $500,000. So we said, okay, by the end of March, which was 5 months. And I said, okay, you're crazy. This is not going to work. You got to be kidding me. But I want you to know, with Mark and Wendy, you just say, let's get it done. And the Mark and Wendy Elwood Fund for Substance Abuse Prevention was formed, and it was launched. And for the record, it was successfully completed in 4.5 months. So, but all celebrating and cheerleading aside, Mark and Wendy's gift came about from some really thoughtful conversations that they had, and we wanted for the community to be able to hear that in their own words tonight. So let me turn it over to Mark and Wendy.
Well, thank you, Tracy, and I do want to I want to tell you, Tracy offered me 2 minutes tonight. My wife told me that was twice as much as I deserved, so I only have 1 minute, but I also want to come clean on one other thing. We've been talking for a couple years about giving a gift to help substance abuse and the opioid epidemic, and we weren't sure just exactly what we wanted to do or how we wanted to do it. But we heard Jeff Jones and ASAP had gotten started, and I have high regard for Jeff, and I told Wendy, I said, this is our opportunity. Let's do something. But we had never talked about an amount. And I told Jeff, I said, I kind of want to do something significant, but she and I hadn't defined significant. And one day we were driving up to Indianapolis for dinner, and I said, well, let's talk about an amount. And I didn't know if we were going to land on $5,000 or $10,000, but just because I'm kind of a big thinker, I said, how about $500,000? And Wendy said, that sounds like a good number, let's do it. And but I guess a couple things. We're immensely grateful for the community for supporting this initiative. We've had individuals walk into the Heritage Fund, offer $5 or $10. We've had individuals offer tens of thousands of dollars. Companies and also charities come in a big way, so it's really been quite incredible. Sometimes people say, why are you interested in this issue? And really, it's a couple things. This is uncomfortable to say, and I don't like to say this, but drugs are right here in Columbus. They're in our factories, they're in our parks, they're in our schools, sometimes they're in our churches, they're in our neighborhoods, and even sometimes they're in our homes. And that's heart-wrenching for us. And if you're a parent, you're worried about what your kids are exposed to and what your kids may do. So we wanted to try to make a difference. So that's that's our interest in being involved. And then the final thing, well, two final things. So the ASAP effort is very broad. Healthcare, courts, law enforcement, intervention, and other things. Our interest is primarily in education and prevention among school-aged kids. So we would like to prevent that next child from ever being involved in the first place. So that would be our hope for how a lot of the dollars in the Mark and Wendy Elwood Fund will be used. And then the final thing I want to say is, if you look at the Columbus website, economic development, the visitor center, we describe ourselves as unexpected and unforgettable. So my challenge to us is, why don't we make this the first community of our size that's an entirely drug-free community? Because if we do that, I think the nation and the whole world will describe us as unexpected and unforgettable. So thank you.
Mark and Wendy, thank you for this really amazing gift. You know, your example is just another one of those things that makes this community so terribly special. You know, our community has a record of making remarkable things happen. And when we see something that needs to be fixed, we work together and we fix it. ASAP is a great example of that, and so is the Elwood Fund for the Substance Abuse Prevention. This community knew that opioids were an issue that needed to be fixed, and 225 individuals, families, and groups of people responded quickly and generously to the challenge, and their names are on the banner in the back of the room. The ASAP team, Heritage Fund, and everybody involved in this effort understands that along with a great gift comes great responsibility to use it wisely. So I am excited tonight to share our big idea, and that is Project Prevent. Project Prevent is a grant-based program that supports all prevention efforts in Bartholomew County. Project Prevent will engage the entire community in sharing important information and helping us become a compassionate, prevention-focused community. Project Prevent will get money into the hands of organizations and groups to develop creative programs and approaches to get the facts out, especially targeting young people up to the age of 25. And Project Prevent happens right now, not down the road. Yes, we know it's important to invest in those things that have a longer-term payback, but we also know that this is a crisis and we need immediate action. Project Prevent starts now. Project Prevent will reach out to tax-exempt groups or organizations with some technical assistance and other resources to support creative programming ideas aimed at sharing prevention messages. So that means school-based clubs or teams, nonprofit organizations, faith-based groups. If you can develop a program to educate and share some key messages, which we can provide for you, or other prevention-focused activities, you can request money to support that programming. We want to make sure that you have what you need to create awareness and understanding within your circle. Renting space, providing transportation, hiring a speaker, posters, watching videos, whatever you think will help get the word out. We've got the technical assistance that we need. What we need is your help to create the events. Heritage Fund has used the request for proposal process multiple times in the past, and we have never failed to be impressed by the creativity and innovation in which people respond. So let imagination be your guide. Consider how you can inspire and transmit the basic facts and become part of stopping this epidemic from doing further damage to our friends, our families, and our neighbors. You tell us your idea and we will get you the resources to make it happen. It's just that simple. Beth Morris, Prevention Team Leader, will share some more information about how you can get involved in Project Prevent later in tonight's program. But the real message I want to leave you with is that we know we have the skills and the resources and the knowledge to address this challenge. And we know that we can prevent this crisis. So thank you very much for the role that you play in helping us become the kind of community we know we can be. Thank you. And now, Jeff.
Thank you, Tracy, and thank you, Mark and Wendy, and all the donors for your generosity and commitment to make a lasting impact. This is a perfect example of what makes Bartholomew County special. Now for the part you've all been waiting for, where we're headed. At this time, I'd like to introduce the leaders who have been with ASAP from day one. Beth Morris, Rhonda Fisher, Judge Kelly Benjamin, and Julia Beatty. Julie, I'll hand it off to you to get things started. It's all yours. Do you want me to do your part for you?
Yes, could you? Okay. Good evening, everybody. Thank you so much for coming. Thank you for taking the time again to spend some time with us to learn about the work that ASAP has been focused on for the last few months. As Jeff said, my name is Julia Badian, and I'm the Vice President at Columbus Regional Health that focuses on community health projects and lots of programs that are really aimed at our community's most vulnerable people. I'm leading the ASAP treatment team, and our team includes two others who you'll hear from shortly. Our team is working on treatment solutions and on initiatives that require collaboration and working together between healthcare providers in Bartholomew County, like the hospital system, Centerstone, Windrose, Columbus Regional Health Physician Practices, Adult and Child, Family Services, and St. Peter's, Dr. Teddy Sidoris, and many others who are engaged every day in providing healthcare services to people struggling with addiction. So our team, Dr. Kevin Terrell and Cheryl Buffo, and I will be focusing on these 4 bubbles in our remarks tonight. So I need the bubbles. There they are. So, county health system, prescribing practices, outpatient treatment, and inpatient treatment. When we started our work a year ago, we really didn't know a lot, to be honest with you. We didn't know what the needs would be, or what the needs were. We didn't know what the obstacles were, or what the solutions were that we would be proposing. We did know, however, how we were going to be doing the work and how we were going to make decisions. We promised you a year ago that whatever we did, we would make our decisions about filling the treatment gaps based on best practices, that we would avoid duplicating services to ensure that treatment is available to everyone, and that we would seek external funding first when possible. So in other words, we wanted to have the best, most effective treatment available to everyone who needs it. And we knew we couldn't go it alone, that we would need partners throughout our region and at the state and national levels. In October, if you were here, we shared our best guesses at what this would mean. But they were halfway informed guesses at that point, I'll just be honest. So we wanted to have expert advice. And so we reached out to the nation's expert on addiction treatment, Hazelden Betty Ford. And I want to take a moment to thank 2 people who really encouraged us to consult with them. That would be John McGinty and Charlie Wells. They have been devoted admirers of Hazelden Betty Ford for a long time. And then when we got involved with this, they were encouraging us to learn from the people who do this work the best. And so we ultimately ended up doing that. And thanks now to our engagement with Hazelden, we now have a treatment and recovery roadmap validated by the nation's best thinkers and doers on addiction treatment and recovery. Our Hazelden partner, Jordan Hansen, is actually here tonight. And Jordan, would you stand up and so everybody can see you? And thank you. We really appreciate it. Jordan has been wonderful to work with. He knows this world very intimately. He's got a lot of expertise. He brought a lot of his knowledge that he has gained through working at Hazelden for a long time and traveling the nation, trying to spread the word about what best practice is when it comes to treatment and recovery. And so we, Bartholomew County, are going to benefit over the long run from having his and Hazelden's expertise. So all the treatment and recovery specifics that you're going to hear about tonight from the treatment and recovery teams are based on best practices, as we promised. And they've now been validated by our friends at Hazelden, so that you, our community in Bartholomew County, can rest assured that the investments that we're going to be making in treatment and recovery resources in our community will have the greatest odds for success. So I'm going to turn things over now to Dr. Kevin Terrell, who is the ASAP physician lead. And Kevin? There he is.
Sneaking up on
Okay. I'm going to give you this.
Thank
Took me
you.
a while to figure out that
Well,
that's
may
what
take
it
me a
was.
while, too.
All right.
All right, well, thanks so much, Julie, and thank you to all of you for coming out this evening. When you have an event like this, you never know what kind of turnout you're going to have, and so I'm always, I'm thrilled to see this number of people there. Thank you for your support. We certainly couldn't do it without you. I am an emergency physician. I worked in the Columbus Regional Health ED for about 7 years. I am the physician lead for ASAP and the Columbus Regional Health Chief of Staff-elect. We had 30 overdoses in our community last year. 30 overdose deaths last year. That's one overdose death about every 12 days. That's also about 2.5 times more deaths than we had the previous year. As you can see, this trend is not one that we want to continue. And so we're working toward wiping out that trend and getting it where it was, even better than 2015. We also know that 75% of people who use heroin started with opioid pain pills. They may have gotten those pain pills from a variety of sources. They may have gotten them from friends or family. They might have gotten them on the street through purchasing them. What hurts me is that they may have also gotten them from a well-intentioned physician who was just trying to alleviate their pain and suffering. And so pills are really the fuel for this epidemic. And it isn't all physicians' faults. There are a variety of things that led to this. I'm not going to get into that today, but the point is we have to dry up that fuel for this opioid epidemic. We know that doctors are continuing to overprescribe. We know that 60% of people, when they receive a prescription, have leftover pills, and they just don't throw those away or dispose of them properly. 60% of people hang on to those, just in case. Just in case they get another ankle sprain, just in case their back hurts, they get a bad headache, or whatever reason. More concerning, about 20% of people don't just hang on to those pills, but they share those pills. What we're doing to address this with respect to pain management is that we've assembled 4 work groups. Each of those work groups consist of physician leaders who work in the places that are most likely to prescribe opioid pills. So we've got physician leaders from the emergency department, we've got physician leaders from the inpatient arena where people work in the hospital, doctors work in the hospital and administer opioids and then prescribe opioids at the end of the hospital stay. We also have primary care physicians who work in the outpatient or ambulatory setting, as well as surgeons who prescribe opioid pain pills after people have a procedure, whether it's a tubal ligation, appendectomy, hip replacement, or whatever it might be. But we aren't just working with doctors. We're also working with nurse leaders who are experts in these areas of care. We're working with a Lean Sigma Black Belt, a medical librarian, and others to really be sure that we're doing this right. So each of these work groups has been charged with identifying pain management protocols, order sets, to use within those environments. As Julie suggested, these are all based on best practices with the goal of, 1, alleviating suffering, but 2, and just as importantly, doing it safely. We don't want people to turn into, people who have problems with opioids. And so we want to try to knock out this fuel while we can. What we're doing with all of those pain management protocols is we're going to insert them into our electronic medical record, and then after we do that, every doctor who works within our health system will have those pain management protocols at their fingertips. So the next time a person comes in the emergency department with a broken bone, there will be recommendations for how many opioids are appropriate for that type of broken bone. That will help give opioids only to the right people and also try to appropriately give the right number of tablets for each patient. We're not so insular that we're just working within our health system. we want the rest of the community to thrive as well. And so we're going to work with physicians who don't work within Columbus Regional Health. We also know that dentists and oral surgeons and probably other providers prescribe opioids. We're going to take what we learn and share it with them. We're going to work with them with the hope that they will engage with us, to embrace what we're doing, and utilize what we've learned. May need to modify it based on their specific circumstances, but we want to share it. As Julie said, we want our community to be the smartest and best at pain management and opioid prescribing safety. I would bet that everyone in this room has an opinion on MAT. I would bet that all of you have heard about it, you've all thought about it, you've heard a variety of things. I'm not here to, spend a bunch of time talking about it, but I want to introduce MAT and share a couple key concepts. The first important concept is MAT is not just medicine. MAT needs to be accompanied by behavioral therapy and social support. I will say that medicine isn't right for everybody. Not everyone who has opioid use disorder needs it. There are some people who are able to get away from opioids and stay away from opioids without medicine, but most people, it turns out, do need medicine to help reduce cravings and for the other reasons that I'll get into it shortly. There have been 3 medicines approved for opioid use disorder. They all have different rules and regulations around their use, and each of them works a little bit differently. Cognitive behavioral therapy and coping skills are 2 critical features of the behavioral therapy that people need to help stay away from opioids and to make good decisions. People also need friends and family. Unfortunately, many people who have opioid use disorders have alienated themselves from their family members. And so people who are in that circumstance probably need to go to some place that's a 12-step program such as Narcotics Anonymous or others. The reason I'm an advocate for medications is that medications reduce craving. They reduce this incessant thinking of, when am I going to get my next pill? When am I going to be able to get my next dose of heroin? It allows people to get to a normal state of mind so that they can function, so that they can be contributing members of society. As I'm implying, it's more about the community, or as much about the community as it is about the individual. So folks who are on MAT, they are more likely to be productive citizens. They have improved social functioning. They can get jobs. They they hopefully reconcile relationships. But more importantly for the community is that these folks have reductions in their criminal activity. They have a less likelihood of death. They have fewer overdoses, and there's less hepatitis and HIV transmission when MAT is implemented. All of these things are very clearly important for the community. So a few points that I'd like you to walk away from with at least my part of this are that I'm not looking to take away everybody's pain pills. There are many justifiable reasons to prescribe opioids. It's just got to be the right person for the right condition and for the right duration. We're also working with our providers, as I mentioned, to develop safe and effective pain management practices. Third, MAT is safe and effective. That's been proven, and it also is just much more than just medication. It's the behavioral therapy piece of it and the social support that are key ingredients as well. Another final point is that MAT, there are a few areas within our community where a person can get MAT, but we need many, many more. Thank you. Next up is my friend Cheryl Buffo. She's going to talk about some additional things that our treatment team is doing. Cheryl?
Thank you, Kevin. Good evening. Get organized here. All right. So at this this one-year milestone of working on and addressing this crisis, there are a few things that we know about substance use disorder and their treatment. Waiting for a loved one to hit rock bottom in hopes that they will be ready for treatment can be deadly. Our community's mindset and treatment strategy need to address this tragic reality. Where treatment is concerned, one size does not fit all. Every person's situation is different, and we need to provide many avenues and entry points to substance use disorder treatment. Returning to the use of illicit drugs or alcohol is a common part of a person's recovery journey. As Dr. Terrell just stated, we know a person's chances of success are greatly improved when treatment with medication combined with ongoing counseling and support services. Outpatient treatment is readily available and expanding in our community. For those suffering with addiction, a number of treatment options are currently available. We are grateful for outpatient services that are currently being provided by Centerstone, St. Peter's, Dr. Teddy Sidoris, and others. Outpatient treatment options are expanding as well. Dr. Sidoris became a board-certified addiction specialist in February and will soon be able to greatly expand her practice. The state of Indiana is adding 5 new treatment centers by June of this year, and 2 of those will be in Greenwood and Bloomington. And then they also just announced new legislation that they're going to be adding 9 more new centers throughout the state within the year. Additionally, new providers are opening office-based practices to increase treatment capacity in our community. We know that we need more, and increasing outpatient capacity is a goal for 2018, and Julie will talk more about that shortly. Residential treatment is available and expanding as well. For those suffering with addiction now, residential treatment options are currently available. Fairbanks, Valley Vista, Terra, Harris House, Wheeler Mission, Harbor Lights, Hickory House, and others. Centerstone has expanded their residential treatment capacity for men in Richmond and Bloomington, and for women in Bloomington and Scott County. They will soon be adding more treatment beds in Columbus as well. We're excited about a new program that's being offered by Indiana Family and Social Service Administration called Open Beds. And it's a program where a treatment provider can call 211 and find available treatment beds in Indiana real time based on the specific need of the person seeking treatment. However, this new system has also identified a major gap in treatment access for many, and that's insurance. With the help of 211, we are finding that there are often treatment beds available for people in these facilities, but a lack of insurance is a barrier to access for many people. So addressing this issue is going to be a priority for ASAP in the coming year. We were also really pleased when we talked to Dr. Walthall today to find out that it's going to be a priority for her department as well. So for tonight, what I'm really excited to share with you is our progress on the partnership that we have with Volunteers of America. VOA has a purchase pending on a building on Washington Street for a residential treatment center for women who are suffering from addiction, and these women they are either pregnant or they have children who are at risk of being placed in foster care because of mom's addiction. So the Fresh Start Recovery Center in Indianapolis was just recently in the news.
Moms out there that are so afraid to they're so afraid to reach out because they don't have anywhere to take their children.
I'm Erica Fly. Thousands of Hoosiers face the battle against opioid addiction, and some of them are pregnant moms. But there's a recovery center right here in downtown Indianapolis to help those mothers. RTV6's Nicole Griffin with One Mother's Mission to Sobriety.
Tonight there are women here at the Volunteers of America building in downtown Indianapolis that are taking part in the Fresh Start Recovery Program. These are moms who were pregnant and addicted to drugs. I talked to one of those moms who actually was able to get clean after many years, but she tells me there was a tragic event that happened in her life that actually caused her to turn back to drugs.
My mom started giving me pills when I was 13 years old.
Years of addiction started at an early age for Laura Bratton.
So I've been on stuff my entire life until 2016 was the first time I got sober.
But unfortunately, her sobriety didn't last. Bratton is now one of dozens of moms currently in treatment at Fresh Start Recovery, along with her newborn baby boy, Raylan.
May 28th, 2017, I got married. I was married for about a month, and he passed away from overdose on heroin. I lost it. When his heart stopped, I ran out of the room, and I was ready to die. I wanted him to kill me. I mean, I was done.
And the very next day, that's when she found out she was pregnant.
This is his baby.
Bratton says she started using again until January when she checked in to Fresh Start Recovery.
She was able to start her recovery process, her addictions treatment, when she was pregnant.
During the addiction treatment program, the goal is to prevent opening a case with the Department of Child Services and help addicted pregnant women have healthy babies.
What happens is when they give birth to babies that test positive, there's an open DCS case, and those babies oftentimes do not go home with the mother. They end up in foster care, etc.
I am grateful that I got to bring my baby here and that I was able to get help in time so that I knew that my baby was going to be safe and healthy.
Bratton says she gets to focus on her treatment at the same time as she gets to bond with her baby. Nicole Griffin, RTV6.
Fresh Start Recovery now wants other mothers who are struggling with addiction right now to know this is an option for them. Call them if you need help or you want to make a referral.
So we're thrilled to be bringing this evidence-based best practice to our community. The Fresh Start Recovery Center in Indianapolis consistently has about 100 women on their waiting list at any given time. And generally, about 25% of those women are from our area. So the Fresh Start Recovery Center in Columbus will be able to house up to 23 women who can be joined in treatment by up to 2 of her children under the age of 5. And VOA is working toward having the program, the treatment center here in Columbus, open by the end of this year. 2 of our partners from Volunteers of America are in the audience this evening: John Von Arx, President and CEO of Fresh Start Recovery, and Rachel Halleck, Senior Director of Behavioral Health. They're already spending a great deal of time in Columbus building community partnerships. Lastly, we know that treatment alone is not enough. People in recovery need years of wraparound services and compassionate support to ensure their success. That's why a community-wide system of support, including recovery programs, sober housing, and harm reduction services, is critical to a person's successful recovery. We are very grateful to our neighbors at Turning Point and the Lincoln Central Neighborhood Family Center, who have already stepped up to offer their many support programs to the women and children who will be in Fresh Start Recovery. In the near future, there will be many ways that community members can partner with Volunteers of America to love and support these women and their babies. Now Julie's going to share more about some of the other health system projects that we're working on.
So just to reorient, we are talking about this part of the system support, the county health system. Dr. Terrell talked about the prescribing practices. Cheryl talked about one new inpatient residential treatment center. And I'm going to share with you the progress that we're making on some additional services in both the outpatient and inpatient treatment realms. So projects in progress. We shared with you in October that CRH, Columbus Regional Health, had decided that we are going to be opening an addiction medicine specialty clinic within the Columbus Regional Health System. We want you to know that that work is continuing. It's complex to open up a new practice, especially a practice that we don't have a lot of experience with. So we are very committed to learning as much as we can about what would be the best kind of addiction medicine specialty practice to have in place. We know it's a going to be a combination of medicine and a lot of the elements that Dr. Terrell mentioned, the behavioral therapy, the supports, and we are really looking forward. We've started conversations with our community mental health partner, Centerstone, about how we can work together on implementing this addiction medicine specialty clinic. And what that will mean is it's another kind of specialty clinic that our primary care physicians can refer their patients to who are struggling with addiction. We hope that this clinic will be up and running by the time that Fresh Start Recovery is up and running too. We know that when moms go into the treatment center, that when they come out, they're going to need to be supported. So at the very least, we want to be ready when they're here. And we've got a new population of moms in recovery. We would love it to be sooner than that, but it always takes time to open a new practice, and we want to be sure that we're doing it right and we're getting the best people in the practice. Other things that are happening and in progress, no longer theoretical, but actually happening, is Centerstone has received a grant to have recovery peer coaches in the CRH emergency department. They have just informed us in the last week that they've hired their first recovery coach. And not only is the recovery coach going to be located in the emergency department, but also this person is going to be available for any other patients throughout the hospital who may be ready to be considering treatment, or entering recovery. And so the idea of having a recovery coach is to have a person who is a peer, who's somebody who is in recovery themselves, long-term recovery, and has special training to engage with people at the moment when they might be ready to consider taking a different path. And so we're really excited to be working with Centerstone on this project. And we're hopeful that by midsummer we are going to have our recovery coaches up and running. We think that we're going to start the program in May, and that we'll be fully functioning and humming along by midsummer. Also, we shared with you last time also that Centerstone had opened a treatment center for women down in Scott County. That we consider that our region. Providers locally will be able to refer women to into the Centerstone residential facility. This is a treatment resource for women without children. So they fill a different niche than what VOA is going to serve locally. Additionally, Centerstone, since we last met, has announced that they are going to be opening another residential treatment center in Bartholomew County. And we're awaiting the details on that. They've got some decisions to make, but we're very excited that they are going to be able to provide additional treatment beds right here within Bartholomew County. Projects that are under development. So the first three that I mentioned we're really making good progress on. The next few that I'm going to talk about are still under development. We want to have in our community an integrated primary care and behavioral health practice. And we're running into some roadblocks and taking some twists and turns with this one, but this is a model that we have studied in other communities. We had a group go to Decatur, Illinois. They've got a wonderful example there that we would like to replicate here if we can, to have an integrated primary care and behavioral health practice right here in Bartholomew County. Also under development is to have what's called medically managed withdrawal and or induction at Columbus Regional Health. Some people call this detox. That's kind of a catch-all phrase. It doesn't really differentiate between the different kinds of ways to enter recovery, but the idea here is that We need to be able to, when people present at the hospital who are actively needing treatment, that we have the resources in the hospital to be able to start them right at that moment onto their path of into recovery. We need to, though, we need to have these other resources in place to do this piece of it. A lot of these treatment resources are sequential, and but we are, once we get our addiction medicine clinic up and going, and once we have additional primary care resources in place, and once we have more treatment beds available, then we will have places for people to go if they come into the emergency department overdosing and ready to be entering into treatment and recovery. So our goal is to have the right treatment available at the right time in all of the right places. And the health system is one set of places where treatment needs to begin and treatment needs to happen. And we want to have as many resources as possible within our county's health system. But there are other places that we also need to have both treatment and access to treatment. And Judge Kelly Benjamin is going to tell us about some of those treatment options that are forthcoming in the court system. Thank you.
Thank you all sincerely for being here tonight. The only way we are going to address and conquer this crisis is to do it together, with knowledge, education, compassion, and thoughtful strategy, and by refusing to make some of the same ongoing past mistakes that have led us here. It's time to change. It's time to move forward. It's time to work together, and the time is now. Our history with opium and drug issues extends well over 100 years. It started with a wide array of people using opium back in the late 1800s. The increased use and popularity of opium back then resulted in string legislative measures. They were designed to crack down on the addictive habit, control distribution, and acknowledge the danger of its use. Even back in the 1930s, there was a recognition that research needed to be done to better understand drug addiction. States were then given more direction and authority to prosecute cases consistently and work cooperatively with federal agencies. In October 1970, President Nixon signed the Controlled Substances Act. It consolidated over 50 drug laws that had followed the Harrison Act. It was designed to control the legitimate drug industry as well as curtail the illegal actions. And as some of you might recall, in 1970, drugs were labeled Public Enemy #1, a title arguably that still remains today. A call for the prevention of new addicts and the rehabilitation of those who are addicted was implemented 40 years ago. Sound familiar now? And the war on drugs, it was directed toward eradication, interdiction, and incarceration, getting tougher on crime, so to speak. Minimum sentences were imposed and higher penalties. And how did over 50 years of foundational legislation and effort work out? Here we are. We know we want to not repeat the past. It's not just about laws and enforcement, it's about people. We can turn the 100-year tide. We know supply will not cease without a decrease in demand. We can work toward addressing both at the same time and with the same vitality. We cannot just be tough on crime. We have to be smart on crime. That takes collaboration and understanding, and that takes all of us. Drugs care not who you are, what you do, under what circumstances you first use them, or where you are from. It does not care if you are white, black, Hispanic, tall, short, rich, poor, female, male, grandparent, high school star athlete, business owner, politician, honor student, newborn baby. Addiction is non-discriminatory. It leads a person and a family down a path and straight to hell. The court system and the criminal justice system, the community, it sees it every day. As in the opium dens from the late 1800s, we still see people from every neighborhood. Court can be quite different now. In years past, parents and others would beg us to let their loved ones out of jail. Today, they sometimes beg us to keep them in, for at least then they know where they're at and that they're alive. So here today, we understand, we accept, and we commit to change the path of this crisis. J. Irwin Miller said, "It is ridiculous ever to forget that you and your business each are implanted in the society of the moment. This is our moment. We cannot ignore the world of our time, and we had better understand it," he said. We know we understand it now. We can work together to address it. So how are we going to do it? Not by building bigger jails and prisons. Been there, done that, doesn't work. Why do you think the law recently changed to no longer allow many low-level drug users to be sentenced to prison, and instead are required to stay in the local jails or be put on probation? It's about local people and treatment to resolve the problem, not extended incarceration to hold them, then release them, then wait for it to happen again. It's time to reflect on the data and implement evidence-based research, the programs and processes that have been shown and are proven to increase the probability of a person recovering, a family healing, a reduction in recidivism, and thus a different outcome than the last 100 years. This cannot be done in silos. It will take the dedication and the commitment of everyone, and I am not too proud to state that the intervention team requires your assistance, please. So what is the intervention team looking at? What are some of the proven methods? One is problem-solving courts. In Indiana, problem-solving courts have to be improved and overseen by the Office of Court Services, which is overseen by the Indiana Supreme Court. So what makes these specialty courts effective? Evidence-based screening and assessment tools are used to identify appropriate individuals to be accepted into the court. Those accepted usually include people who are higher risk and higher need. Under a judicially supervised court docket, there is a proper balance struck between, first, the need to treat a person suffering from a substance use disorder, and the need to protect community safety. Second, a need for effective treatment through a less adversarial process, and the need to hold people accountable for their actions. And third, the need to balance between hope and redemption on the one hand and the productive citizenship on the other. Judges also take a more hands-on approach with increased court appearances to promptly address problems and encourage a change in a person's behavior. The focus is centered on addressing and resolving underlying problems or trauma, not just substance issues. And finally, evidence-based research also supports the use of medicine assistance, if appropriate, as part of treatment and in addition to counseling and support services. In the past couple of years, we have seen an increase in substantiated child neglect cases due to parental addiction to substances. That did not set well with many of us, but particularly with Magistrate Heather Mallow, who presides over the juvenile cases in circuit court. So she and consultant Pam Clark engaged other members of the juvenile court team and worked for over a year to implement a family recovery court. As of this month, that court is now accepted by the state and certified. In fact, Judge Mallow let me know that the first family has been accepted into this program 2 days ago. Parents who complete She's done a great job. Fabulous person. Parents who complete this intense program will be significantly more likely to be reunited with their children, more likely to succeed at recovery, and their children have a better chance of spending much less time in out-of-home placement. The court will need your support to continue. We are now considering a problem-solving drug court for adult criminals. Low-level drug-related cases doubled between 2014 and 16, but unlike treatment through juvenile court that can be contracted, no contracted treatment options are available to adult court. Treatment must come from this community. Insurance and cost matters, and they are hurdles. In order to learn how these courts are run and the type of community options that may be available, myself along with Brad Barnes, Chip James, and Stacy Harry from Court Services, Prosecutor Bill Nash, Attorney Mike DeArmit, Chief of Police John Rohde, City Council Member Lori Boer, County Commissioner Carl Lenup, County Councilwoman Laura DeDominic, Mayor Jim Lenup, Charlie Wells, Debbie Tyke, Anna Hillicord from Centerstone, and Rhonda Fisher and Cheryl Buffalo from ASAP have traveled to different recommended courts. Policies and procedures are currently being drafted, and if we can work together in this county to provide appropriate evidence-based and readily accessible treatment, recovery, and support services, the hope is to start an adult criminal drug court in 2019. We're going to need your help. Why do it? For starters, 75% of drug court graduates nationwide remain arrest-free for after 2 years from leaving the program. We know we can take some of the highest need and the highest risk persons we see in court, and we can make a difference in their lives. Drug court works to reunite families, repair lives, reduce drug abuse and crime, and do it all for fewer tax dollars than jails or prison. That evidence has been accumulating and consistent since the 1990s. Next, many of you have heard of the WRAP program offered through Court Services, Women Recovering with a Purpose. It's a year-long probationary program in which women are in a locked residential unit for treatment and recovery, and then slowly reintegrated into the community. It's intense, and it's not easy to complete. We only have enough resources to allow 15 women to participate at any given time. We have women asking us to be in the program, even knowing it's guaranteed they will see very little of their family for a year. They do it to work towards saving their life and living free from those substances. That takes courage and commitment. Most treatment and counseling programs strive to get near a 50% completion rate. WRAP is at 55. In addition, the average reduction in risk to reoffend after completing that program is between 30 and 35%. That's significant. I attended a WRAP graduation last week, a remarkable class with some remarkable women. Yes, that comment coming from a judge who may have had a hand in sending some of them to jail to begin with. We want to see success. We want to see people live. The point being, recovery works when someone wants to change, but also needs the help, the push, and the support. They need you. Rob Gaskell, the director of the WRAP program, is currently working toward implementing a Winner's Circle program, which can offer those who have graduated from WRAP and successfully completed probation an opportunity to be trained on how to become a mentor to others. This is another evidence-based program to further assist in additional treatment, and he hopes to start that within a year. In addition, we are also working toward implementation of a men's program, similar to that of WRAP. We were hoping to implement this program by this summer. 2 grants were applied for. One was awarded, and we just found out this week one was not. The one we were awarded is contingent upon the remaining funding, so we will continue to try and seek that funding. We have a significant and a desperate need for this men's program. Sheriff Matt Myers is working in collaboration with ASAP and partners in this community in considering an evidence-based jail treatment program, and that would be geared to those serving longer sentences and focused on successful reentry within this community. Such desire, however, has been limited due to overcrowding, classification issues, and resources. Cummins Black Belt Elizabeth Powers is the project leader helping to research and assess programs, and along with Major Chris Lane, they are currently making site visits to other jail treatment programs known to be effective. We expect those visits to be done within the next couple months. The results will be analyzed and jail treatment options will be discussed. However, prior to any reality of implementing a jail treatment program, the very real issue of jail overcrowding has to be resolved. This is a priority, and the sheriff is working to address that. The courts started a pretrial jail release program back in October of 2016, geared toward releasing low-risk offenders. However, there has been such an increase in arrests that the jail population has continued to escalate even after those releases. However, with the pretrial program pilot, there would be probably an additional 40 people in the jail today. Finally, one pretrial program Chief of Police John Rohde is helping me look at right now is LEAD, Law Enforcement Assisted Diversion. It aims to break a common cycle, one in which a person is arrested and jailed for nonviolent crimes often related to addiction. Under LEAD, the person can be diverted into a social service worker who helps arrange drug treatment, housing, and other services within the community. In order to do that, I have to look over to my friends there, and I have to look out at you. We need you to be able to do that. We need the community. The preliminary data on this program has indicated positive effects on recidivism, so we're taking a look at it within this next year. One thing I want to stress, as much as we've seen an increase in numbers for substance use disorder, we do see recovery, and we see those working toward recovery. The RAP graduation last week was one filled with pride, love, and thankfulness for and from the ladies themselves, as well as their family members and community members who were there. That type of hope and reality we cannot lose. As Martin Luther King Jr. said, if you lose hope, somehow you lose that vitality that keeps life moving. You lose that courage to be, that quality that helps you go on in spite of it all. So today I have a dream. How many times I'm sure that quote has been recited, but how appropriate for here and for now. Many say this problem is too big, that you'll never make a dent. And I believe I've heard it responded to in this way before, and I believe it was Jeff who may have said this maybe a little bit over a year ago, but it's like the devil whispering in your ear, Columbus, you're not strong enough to withstand this storm. Well, we've got some whispering back. Columbus is the storm. We know we can. Thank you. And it is my pleasure to introduce Rhonda Fisher, who is our project leader for ASAP Overall and the lead of the hub.
Thank you so much, Kelly. All right, my name is Rhonda Fisher. I'm the program manager for ASAP, and that means that I'm in the fortunate position to work across the whole system. I get to participate in many of the project teams. I help Jeff as well as Matthew, our communications manager, in whatever comes up. We do a lot of connecting, whether that's individuals or organizations, and it's a balance between being flexible to handle opportunities as well as holding the pieces together, you might say. We've been very fortunate. I mean, one of the pieces of the program management is keeping track of the projects. And we've been fortunate to have a professional in this space, a woman, Vatsala Sharma, who's been helping us meet with the critical elements leaders and documenting the projects. And she's just an example of one of the sort of amazing people I see throughout the system. In the recovery space, we know it's about having a safe place to live and connecting people who care. Without ongoing support, the other components of the inner system won't succeed. It's an example of how the whole is better than the sum of the parts. If people leaving jail can't get integrated into the community, or people in treatment can't get the right kind of support they need, then the other components of the system won't succeed. It can be a lot of work going through the treatment, going through these different programs, and they can be expensive. If by the time they get to recovery, it breaks down, then the whole system's at risk, and this is at a personal level. There was a quote from a man in recovery who says, "You can be on the good path, but if something happens in your life and you think you're not worth anything, you do stupid things." I remember a Centerstone counselor talking about a time that he was starting somebody on their recovery journey, and there's a form they need to fill out. You know, one of the questions is, what are your hobbies? And there was a pause in the reply, and he looks up, and the man's in tears. He says, "You know, I spent so much of my life looking for drugs, I don't even really know what I like to do anymore." And what we envision in the recovery place is that this counselor can link this young man up with a team of community-trained mentors that can get to know this young man, talk to him about the things they like to do, where this man can live in a safe home in a therapeutic community where the other residents look out for each other, that there's transportation to a range of recovery meetings as well as different kinds of treatment, and also fun events to share in with the community. We can make this happen. Recovery is really where the power of the people comes in. I mean, it's the part of the system that the community owns and brings to life. We also know that healthcare is an important part of recovery. Many of the questions that we receive from individuals and family members have to do with covering the costs of treatment and the cost of living while the brain heals. How many times will insurance cover treatment? What does someone do until their insurance is activated? Are maintenance prescriptions covered? We can help people work through their questions by training compassionate volunteers who link them to community support. 3 people sitting in the front row are giving now and going above and beyond in their leadership efforts on the recovery team. It includes Anna Hillicord, who's the manager of Adult and Family Services at Centerstone. She leads the hub team and also works across the quadrants. An example of going beyond is she spent 10 of her recent Sundays meeting with different faith communities on the hub concept. We're going to be at Hope Moravian at 11:15 on Sunday if you want to join a hub discussion. Ben Jackson, our Columbus trustee, is also on the hub team, and he leads the housing team, which, I made a mistake.
He has a fan club, yeah.
Oh, he has a fan club, okay. Well, he's on the hub team and he leads the housing team. And there's a recent success in housing. They secured a $300,000 grant from ICTA, that stands for the Indiana Housing and Community Development Authority. Scott Hundley from Columbus Community Church leads our recovery programs team, where so much is already happening. They recently updated the list of recovery programs on the ASAP website. It's under the Get Help, and there's maps. And we'll talk about it a little bit more later in the projects. I'm going to talk now about the different projects in each of the recovery quadrant. Housing is an area that often doesn't get a lot of attention. However, it may be the most critical element in the whole system. And honestly, we're concerned in our ability to be able to respond quickly enough. We know having a safe place to live increases the likelihood of success and how difficult recovery can be without it. People in outpatient treatment or those coming sober from jail need a supportive place to keep organized and on track to reach their goals. We hear repeatedly from talking to people with addictions, they don't want to leave their larger support network. Maybe they have a job, their family, it's their hometown, but they need to get out of their existing living conditions where triggers and drugs are often too frequent. The housing team has 3 active projects. The first one I mentioned earlier with the ICTA grant, and this will help the young women, or the women coming from the RAP program, be able to get some help with their rent. The other 2 housing team projects are likely working to close the largest gaps in the system. Transitional homes are safe places to stay while the brain heals. Maybe that's 2 years, maybe it's 6 months. One team is working on a transitional home for men and the other on a transitional home for women. These are not franchises. We know from our research they're locally owned and operated by people who care about recovery. For example, in North Vernon, I think there's 5 churches that are working together with some startup donation they got from a local factory to open a transitional home called Potter's Place. There is a state association starting to offer accreditation, and this will continue to evolve. If this is a place, if you're feeling called to help, transitional housing is an area that we're going to need the community support, both in finding sponsors who will champion a home and those who will welcome the residents. We want it such that everyone is confident in their safety, security, and privacy. Ben has a team helping with research, including Manju, the Badgeleys, Bill Jones, and others. In recovery programs, again led by Scott Hundley, it's an area where there is already much going on to be celebrated, where sponsors and leaders from the community are already giving. Charlie Wells, Lisa Pine, Deb Tyke are examples of people who reach out to others and put structures in place for ongoing change. Rural churches like Ogleville Christian, larger downtown churches like St. Peter's, and community churches like the Community Church of Columbus are examples of the range and participation from faith-based communities in sponsoring recovery programs. The recovery programs team, with help from another Six Sigma belt from Cummins, Justin Booth, led a gap analysis and launched 5 spin-off projects. All of them focused on making recovery group meetings available to as many people as possible. The first project is increasing the number and diversity of recovery meetings, including more AA, Narcotics Anonymous, Heroin Anonymous. We have our first Heroin Anonymous meeting happening in Bartholomew County now, so celebrate that. We also want to have Spanish-speaking programs. More Celebrate Recovery, which is Christ-centered, as well as Smart Recovery, which is a non-faith-based program. We want to be able to increase child care opportunities during recovery meetings, have more healthy social events, and the last project is to update and keep an accurate list of recovery meetings on the website. Since Justin's a Six Sigma belt, not only we got it updated, we're going to get the right processes in place to ensure it's updated on an ongoing basis. We can increase the number and diversity of recovery programs. The main constraint to growth is committed volunteers to facilitate meetings. Facilitators need to be able to commit for a few years to bring that kind of consistency. If you feel called, this is another area where we need help. The Hub. The Hub brings everything discussed so far together, both within the recovery quadrant and the whole system. It's the centerpiece connected to every other critical element. We want the Hub to be a place, right now it's a concept. Bill Jones describes it as a resource center. It's where people and their family and friends can go for answers, links, and community. This is an area where volunteers are absolutely critical, both as part of designing processes and for when we open the doors. We want the Hub to be warm and welcoming. We see a small staff with an army of recovery-trained volunteers. People will be able to walk into the Hub or visit virtually. Recovery-oriented partners will be accessible through the Hub, for example, Centerstone, Columbus Regional Health, United Way agencies, and smaller agencies. I see Dennis recognizes himself in this picture. Smaller groups like the Malachi's Closet that's run by a husband and wife team, Becky and Barry Renner. It's helping homeless people find some clothing and some small household appliances. We appreciate all the people who have expressed interest in volunteering. The direction we're heading is to have a full-time volunteer coordinator who will provide the structure needed to safely and productively engage volunteers. We can do this. We expect to make a proposal to the Substance Abuse Public Funding Board for staff positions within the Hub and some of the other operating expenses. We'd like to see the Hub open in this next year, ideally by the end of this calendar year. Hopefully, we'll see all of you there, whether it's giving or receiving. In closing about recovery, we know it's about caring. And because we care, there's hope, and hope leads to recovery. And now for Beth.
Thanks, Rhonda. I'm Beth Morris, Director of Community Health Partnerships for Columbus Regional, and I have the privilege of leading the prevention team, a group of 30 community professionals and community volunteers who've worked very hard over the last year to really bring a focus on prevention. So we live in that green circle around the system of support. Rhonda provided a great segue to this slide, which I stole from It's not there. There's a really nice slide that Dr. Walthall developed that talks about education leading to understanding, leading to empathy, which brings hope, and ultimately recovery. And I think that that sequence really makes a lot of sense and really helps frame a lot of what the prevention team has been working on. So let me talk about, I shared in October, so indulge me while I repeat this metaphor, because I really want everybody to have a common understanding of what prevention is. And we talk about working upstream. What does that mean? So the metaphor is about the river, and people are being rescued because they've fallen in, and they have to be saved because they're drowning. And so our intervention team, our treatment team, our recovery team are all doing that very important work of trying to pull people out of the river of addiction. But the prevention team is focused in a different spot. We're really focused upstream to try to figure out, why is it that people are falling in the river in the first place? What can we do to fix the guardrail that seems to be broken? And so that's a lot of our focus. So we have 3 upstream strategies that have guided our work. We can increase awareness of the dangers of opioids. We can help diminish the desire to use drugs. And we can reduce access to opioids. One of the primary ways that we've worked on increasing awareness is to have a cadre of 18 community trainers who Nikki Reeland from the Healthy Communities staff has prepared to go out into the community and present key information to any group that is interested. And that invitation continues. So if you have a group that you think could learn a lot about what they need to know, so that we can be the smartest community in the country about opioids, let us know, and we'll be happy to make a speaker available. We try to measure everything we do, and the way we do that with community presentations is to have a pre-test and a post-test. And to date, 98% of the people at the end of the presentation have demonstrated increased knowledge about the key messages that we're trying to share. So in addition to speaking engagements, we've hosted community events, such as this one. Just a couple of weeks ago, we hosted Nick and David Sheff, who have a very personal story about what their family has gone through addiction and recovery. And we're pleased to have one of the 3 presentations that they made was at the schools, so that parents and their students could learn from the Chef's example. We use Facebook and Twitter. We've had wonderful support from our media partners at the Republic and White River Broadcasting. And any number of things have happened organically in the community that we didn't have anything to do with initiating. So let me just give you a couple of examples of that. The 8th graders at Central Middle School last school year created an awareness campaign of their own. They studied what was important to understand about pills and about why people take pills and how addiction works. And they educated one another, and then held a carnival that was a fundraiser for ASAP prevention, but also educated the rest of the school who came to the carnival. Viewpoint Books hosted a concert with a singer-songwriter who's a recovering heroin addict. Another way that can reach a different group than the folks that come to our presentations. Nikki just finished working with a high school senior who did a really creative video that focused on the brain involvement with addiction. He really dummied it down to make it a lot more understandable to his peers in high school. We also certainly want you to make sure that you go to the ASAP website. There's a treasure trove of information there. There's toolkits, there's parent tip cards, there's a lot of resources that we bring to your attention. and a really inspirational blog. So do take advantage of that. So those are some of the ways that we're doing increasing awareness. So what about diminishing desire? Well, that's a big one. That's kind of a daunting one, but it's so important. I shared with you at the October meeting that we were working with Goodwill Industries of Central and Southern Indiana to bring the Nurse Family Partnership Program to Bartholomew County. And I'd like to acknowledge Lisa Crane from Goodwill Industries, who's in the audience and has worked tirelessly to help make that happen. And our very first nurse has been trained, Mandy, wave to the people. She just went through extensive training and is now accepting referrals. So again, this is a program that works with first-time low-income moms and not only helps prevent drug addiction in the moms and the kids, but there are all sorts of other benefits that the research has shown over the last 40 years are really important in terms of the economic health of the family, the educational attainment for mom and child. So we're thrilled that Mandy's here and that we're on our way. What else are we doing to diminish desire? We're very fortunate that our school corporations are absolutely on board with us, with these efforts. Just as the Elwood said, we really need to start young. So Bartholomew Consolidated, Flat Rock Haw Creek, and St. Peter's have all adopted the life skills curriculum, which really has been shown to diminish drug use by targeting the major social and psychological factors that can promote risky behaviors. So that will be starting in the fall. We have other schools that we're visiting. If you haven't heard from us, I can promise you you're on our list. But reach out to us if you're involved with one of the other schools. We would love to help you with that. And the Elwood Prevention Fund is critical to those efforts. We're also pleased to see community interest in helping young people develop the assets they need to be successful. If you haven't already heard about the 40 developmental assets and how we can all be asset builders, you will. There's a good deal of research about these developmental assets. 20 of them are internal to the individual, 20 are external to the person's environment. And the more assets a young person has, the more likely they will succeed, the less likely they will get involved with drugs or other risky behavior. So there's a clear sense that we can all help build assets in young people that we come in contact with. So we've talked about increasing awareness, we've talked about diminishing desire. The third strategy, if you'll remember, was reducing access to drugs. Dr. Terrell's doing the heavy lifting on this one with prescribing practices. But our role in the prevention team is to help ensure that everybody knows not to hold on to drugs that are no longer being used and to dispose of them safely. So a year ago when we launched, there was only one drug disposal box in town, and now there are 3. So CRH added one, and now CVS on National Road also has a drug disposal box. I don't know the numbers of the other 2 boxes, but I can tell you that in the 6 months that the CRH Emergency Department has had the disposal box there have been 200 pounds of drugs that have been turned in. And the take-back... So we also host drug take-back events like the one this evening. And I think within the first 2 or 3 minutes tonight, there were more drugs turned in than the last time we did a drug take-back event. So we thank all of you for cleaning out your medicine cabinet. We thank the Columbus Police Department and the Indiana State Police for making that activity possible, and to Johnson Whitkemper Insurance, who donated restaurant gift cards to reward the people that brought their drugs in. New tonight, an initiative to help you keep active prescriptions out of the hands for those who were not prescribed the medicine. We are very appreciative of a new partnership with the Children's Bureau, who provided a limited number of lockboxes and is interested in doing more. So I'm sort of thinking that some of you probably haven't heard a word I've said because you're still thinking about what Tracy said about this Project Prevent, and you're thinking about all the ways that you might take advantage of it. We are really excited about the community engagement grants that are available right now, just as Tracy stated. With deep gratitude to the generosity and the vision of Mark and Wendy Elwood, Project Prevent hopes to involve every not-for-profit group in the county. There are any number of creative and innovative ways that you can help increase awareness and, again, make us the smartest community in the country about opioids. Here's how it will work. If you're a not-for-profit organization, 501c3 in IRS jargon, or if you have a working relationship with a not-for-profit, we want you to consider applying for one of these grants. The application is on the Heritage Fund website right now, and will be on other websites as well throughout toward the end of the week. Heritage Fund has worked really hard to keep this application. It's the simplest grant application I think I've ever seen, and that was intentional, because Heritage Fund really didn't want to intimidate or put any barriers up for groups that really might want to take advantage of this. So there are also going to be technical assistance resources available both on the website, and Nikki and I will be doing technical assistance workshops, completely optional, but if you feel like you need a little bit more direction or you want to run some ideas by us, we'll be holding some technical assistance workshops to help answer any questions that you have. So maybe you have an idea about how to get those medication lockboxes into your target audience, or maybe you're interested in the developmental assets and you think, oh, it would be really good if the coaches in our sports program understood how to build assets. Maybe you have ideas about an after-school program to introduce young people to different ways to enjoy life without drugs. Maybe you recognize that a number of young people in your youth group seem to have high levels of stress, and you want to help them learn ways to lessen that stress before they start medicating themselves with drugs. Maybe you'd like to bring a speaker to your church and host a discussion for parents about what to look for in a teen's behavior that you should pay attention to. The Children's Bureau also shared a very creative idea that I never would have thought of. There's a mobile trailer that has a teen's bedroom inside the trailer, and it's called Hidden in Plain Sight, and parents can go through the trailer, and there are 100 different clues in there of things that might be indicating that your child could be engaging in risky behavior. So it's a way for parents to kind of educate themselves. So you can see there's some really creative ideas out there. You may have better ideas than any of these. We really want you to be thoughtful and take advantage of this amazing opportunity. So we have, you've heard from everybody up here tonight that we need all of you. We need the whole community to turn this crisis around. So we do have one other request from you this evening, and you all have the We Know We Can paper in your seat. If you would take a moment to start a sentence on one of those sheets that says, I can, and then complete the sentence. Fill in the rest. We would love it if you would put that sticky note on one of the posters. There are 2 poster boards on this side, there are 2 poster boards on that side. So it's not time to leave yet, the best is yet to come, but we would like for you, we really do want to see your ideas, hear your ideas about the ways that you want to be involved. And now I'll bring Jeff back up to introduce our distinguished panelists.
So I hope you appreciate all the hard work and the detailed planning. Let's give our leaders a round of applause. We've got a special guest tonight, and we want to make this an opportunity for Columbus and Bartholomew County to understand what's going on at the state level So it's my pleasure to bring on stage Mr. Jim McClelland and Dr. Jennifer Walthall. Jim and Jen, come on. We spent the afternoon with Jim and Jen, and while it was incredibly valuable to us, and I hope equally as valuable to you, the thing I was really disappointed about was that Jim never acknowledged that I wore the same uniform as he did today. You know? Yeah.
But I did notice.
Yeah, okay, you did notice. Well, I noticed too.
I just wasn't going to say anything.
Yeah, okay, all right. So we've got about 20 minutes and then we'll wind this down. We're going to keep this really casual, and I'd like to start off with both Jim and Jen giving the audience an idea of the role you play in Governor Holcomb's administration, what you've learned over the last 15 months since you've been in these roles, and then after you both do that, we'll talk about your perspectives of what's going on around the state of Indiana. So Jim, why don't you start us off?
All right. Well, first of all, I just want to thank you, Jeff, for inviting us to be part of this and to be able to meet so many of the people who have been who've played such leadership roles in creating what we have heard here tonight, making it all happen, and all the people who have been working with you on this. I think what you've done is just remarkable, and I know that this is just the beginning for what you're going to accomplish. You're going to have really, I think, tremendous impact. And I'm going to play a little bit off your slogan, and I'm just going to say, we know you can, and I know you will.
Thank you.
You got to get it done. My role was created by Governor Holcomb the day it was inaugurated, because he had decided to make attacking the drug problem one of his very top priorities, very serious about this. So he created this position that I'm privileged to hold, and my job basically is to coordinate, align, focus the relevant resources of all the state agencies that touch this issue in one way or another, and then to see how we might leverage the state's resources with those of other sectors: business, higher ed, healthcare, philanthropies, faith-based organizations, other community-based organizations. Try to bring the pieces together in ways that are going to give us the best chance for the greatest impact. Jen and I go all over the state. We see a lot of communities, and we see what's going on. I will tell you that what you're doing here is going to serve as a wonderful example for lots of other communities in this state. Not everybody can do what you're doing here or what you have done. Resources vary from one community to another, but everybody can learn from your experience. And so thank you for the role that you're going to play as a wonderful example, as well as for what you're going to be doing to help reduce a major problem.
Well, I think you had two questions. The first was, what's the role? And the second was, what have we learned in a year and a half? When I was appointed to be the secretary for FSSA last January, I called my mom to let her know. I actually was holding a position in the previous administration as the Deputy Health Commissioner for the Indiana State Department of Health, and actually met several of you in the room during my time as the Medical Incident Command for our Scott County HIV response. I was reappointed to that role by Governor Holcomb when he took office, and about 8 days later I got a phone call that said, I actually have something else that I want you to do. And so when I called my mom to tell her that I had moved to a different role, she gushed, as moms are supposed to do, and then there was a brief pause followed by, what is that? So FSSA is an extraordinary agency. I am privileged to have been in this space for a year and a half, working with Jim and other agency heads. What we did, and what we did in 1991, was we housed all of our social service deliveries under one roof so that we could see people holistically, not by program. And so we are the largest state agency across the state. Between state employees and contractors, we have about 7,500 folks that are out there doing the day-to-day work to connect people to the services that they need. That includes everything from healthcare delivery from Indiana Medicaid, which covers health insurance for 1.5 million Hoosiers, including the newly renewed Healthy Indiana plan to expand Medicaid coverage up to 138% of the federal poverty level, to the Division of Mental Health and Addiction, where the nexus of much of this work that we've talked about tonight really lives and breathes, all the way to early intervention programs like First Steps that does early intervention for 0 to 3 for kids who are at risk for developmental delays, and everything in between. And through the lens of looking across these programs, if I learned one thing, is that what I learned as a kid growing up in Valparaiso, Indiana, is actually everything that I needed to know to do this job. And that is that when you get up in the morning and you get ready to do whatever it is that you're supposed to do, and my mom had a list of those things on the door for us, and it ended with one thing, is go out and love people. And if we do that, then we're going to be fine. And though it wasn't necessarily stated as a slide on the presentation, that's what you're doing. And you have manifested your love for each other in the way that you've built your community and the way that you're delivering your programs. Now, FSSA doesn't necessarily have as our slogan, we love people, but we should, because we do. And it really should be evident in the way that we deliver our programming, that it's not the checkbox that we fill, it's the vigor with which we fill that checkbox. And I hope that you see that that is manifested not just in how I try to lead this agency forward, but in how we partner with each other, how we partner with you, and how we take all of the resources that we have so that every last person that needs them gets them how they need them, when they need them, and for as long as they need them. And that's my call to action for all of us, is to think about how every day when you get up and brush your teeth and think about what you're going to do today, that you fill whatever those spaces are with as much love as you have for the people that surround you. Because this... this is not an us versus them problem. This is a we problem. And we have the answers if we find them together.
Thank you. I'd like to ask each of you to comment on what you think the biggest achievements or most progress has been made in the last year from your perspectives.
Well, when we started tackling this a little over a year ago, we quickly learned, well, Jen already knew it, I didn't know it. I knew it was a big problem. What I had not realized was how complex it is and how many pieces there are to it. So we had to develop a strategic approach to how we were going to tackle it, so we didn't just end up playing whack-a-mole. And we did that. And we set some broad priorities, doing everything that we could to just help keep people alive. But then understanding that people with opioid use disorders have got to have treatment, and we didn't have nearly enough. And so expanding access, timely access to treatment, particularly medication-assisted treatment, has been a really top priority. And I think we've done a lot there. Yeah, and we also had some behind-the-scenes work that we needed to do. Improving the usability of Inspect, which is our prescription drug monitoring program. Now we're integrating, we launched an initiative to integrate Inspect with the electronic health record systems across the state. It just makes the system much more user-friendly and is going to give doctors much more time, or prescribers much more timely access to the information that they need about their patients. So we did that. We have taken a number of initiatives. I'll let you talk about the Cures Act grant and some of the things that we've done there, but there's a long list, and a lot of what we got started last year, we're really now in full implementation mode, and we're going to continue to build on that. But it's moving at an increasingly rapid rate, I think.
I would say, just as a general theme, I think our biggest success in the last year and a half has been alignment. when you think about the different sectors that have to come together to get this done, and folks that have never really thought that they would interact with each other in any way, we're now on work groups together. So I see and feel, which is a good thing. It's not just a feeling, but a real reality of multi-sectors working together. And that's really manifested in things like our conference that we hosted for the first time last year that was Public Health and Public Safety, Combating the Opioid Epidemic Together. There's not a right or a wrong answer here where there's a public health approach and then there's a public safety approach and they're against each other. They're actually, we have to have it all, and we have to all learn how to speak the same language so that those tools actually function in concert with each other, and that's where we get to the end. I saw this really manifested beautifully. Last week I was in LaPorte County for their opioid report out, and they did this really incredible combination of data and then also a qualitative survey, so a survey of the community. And one of the questions they asked the community was, what do you think started or is the problem of this opiate epidemic? And the community response was in 3 themes. The first was that prescribers, doctors in particular, were prescribing too many opiates and that they were being diverted for things that they weren't meant for. That was number 1. Number 2 was that there was heroin trafficking from Chicago and Detroit coming into LaPorte County. And number 3 was that there was despair in the community because the economy was not strong and people didn't have hope for the future. And I couldn't have written that any better. And the perception of the community was absolutely correct, that we have a supply issue, and it's both licit and illicit, that require a public health and a public safety approach to combat, and that we also have to build economic infrastructure in order to get past this so that we can all thrive. It's not really about opiates at all when you get down to it. It's about reinstilling hope for the future in all of our communities so that we can recover together.
I'd like to ask you, Jim, first, and I've got a second question for Jim. What are the biggest missing pieces? You know, where are we in terms of having a really good idea of what we need, but not capable yet of fulfilling that need?
I'll mention a couple of things. We have a huge need for more recovery support systems, and particularly recovery housing. It's been mentioned here prominently this evening. Big need. We've got to come up with a plan in order to be able to meet that need. And then doing more on the prevention side. We're making some really good headway in reducing opioid prescription rates, but we need to be doing a lot more to encourage the use of evidence-based substance abuse prevention programs, such as we heard about tonight. You're already on board with it. Life skills training is a great one. Purdue Extension is implementing, and some other organizations as well, implementing strengthening families curriculum in a number of counties now. That's a good program. Lots of evidence behind its long-term impact. So those are 2 areas where we've got a lot of work yet to do.
So I spend a lot less time sleeping than I used to, not because I'm busy, but because I'm worried about everybody. I have a couple million folks that I have to take care of, and I worry about what's going to happen to them. And so the gap for me is what I have to do, what I'm missing. And so one of the biggest things that we're thinking about and we're trying to tackle right now is something that is affectionately or not affectionately known as the cliff effect. And I'm going to tell you a story to illustrate that really quickly, because that's, I think, where our biggest gap is here. I have a gentleman who is a patient in a recovery program in Indianapolis, has been in successful recovery for a long time, and is doing extraordinarily well. So well that he got a job last fall, and he went to work at one of our local Lowe's, and he was loving it and was in an apartment and really doing a great job. He maintains his recovery through medication-assisted treatment. He's in therapy, and he also gets a monthly injection of a medication called naltrexone. That medicine is actually relatively expensive, but it's covered under Indiana Medicaid, and so that's how he gets his treatment. Over the wintertime, he unfortunately was subject to something called mandatory holiday overtime at Lowe's, which means that in order to compensate for the increased volume coming through retail, you have to work a little bit more. And what happened is that because he was working more, he made just a little bit too much money to qualify for Indiana Medicaid. And he called me and he said, Dr. Jen, I need to know what I am supposed to do. Because if I stop working, then I won't have a job anymore, and I'm really enjoying the independence that I have. But if I keep working and I lose my health insurance, I can't yet afford the $1,000 a month that it's going to cost for me to pay for my medication-assisted treatment out of pocket. And we worked and we tried to recalculate stuff and do all kinds of things, and I called the manager and all of these things, and we couldn't find a solution, and he had to choose between his life and his job. And I'm glad that he chose his life. He quit his job and he stayed on our Medicaid program, but we can't do that anymore. We can't have the cliff effect where I'm asking people to make those decisions every day. And so my pledge to you as we work toward filling those gaps that you asked about is that we actually make reasonable decisions in how we do that, and we help people find their way on that path, not through a cliff, but a gentle stair step, so that as you make your way forward, that you're not penalized for succeeding. And that's our pledge to you.
Thanks, Jen. Thank you very much. Jim, in an earlier conversation today, we talked about momentum, how it feels like to those of us that have been spending a great deal of time on this topic that there's some things starting to shift. I'd like for you to tell our community your thoughts on that.
Yeah. Well, we're starting to see some positive indicators various places around the state. And I will tell you, I kind of look at this as I'm going to use a freight train analogy. I know that's maybe a sensitive topic.
Mayor Levin especially likes that analogy.
Forgive me if that strikes a wrong chord, but when a freight train is standing still, it takes a lot of energy to get it moving. And then as you get it moving, it's building up speed slowly. But then as you continue to increase speed, you're building momentum. And once you reach cruising speed, you got a lot of momentum, and you're going to be really hard to stop. You can still get derailed, but you're going to be hard to stop. And we're picking up speed. You're doing it here. I see it other places around the state. We're picking up speed. We are going to make a serious dent in this problem, and we're going to do it in a whole lot less time than it took to create this crisis. And I'm confident of that. You know, and I see evidence of what I'm about to refer to here in this room, and I've heard it tonight. There's a quote from Dreamland, and I know a lot of you have read Dreamland. Let me show of hands. How many of you? So almost everybody here has read Dreamland. But one of my favorite quotes from Dreamland is when talking about this issue, nobody can do it alone. But no drug dealer nor cartel, you know what I'm going to say, can stand against families, schools, churches, and communities united together. That's what's going to end this thing, and you're well on your way.
Thanks, Jim. It's been a long day for all of us, including the two of you. Thank you for your trip to Columbus. Any final comments?
Thank you for having us. It's been a wonderful day. It's been a wonderful experience. Thanks for what you're doing.
I can't think of anywhere else I would have rather been today. Thanks for having us.
Thanks. Well, let's give a round of applause to our guests. Thank you. It has been a long day. Thanks for your attention. And I'm sure that you all agree, based on what we heard from Jim and Jen, there is no doubt that we can count on the state of Indiana as a partner in this effort. Thanks again to the two of you for spending the time with us. I also want to acknowledge, once again, the dedication and commitment of the members of the ASAP team that I have a privilege to work with every day. As I know you observed tonight, they've made this work their priority, along with their families and full-time jobs. We could not have a better group to meet this challenge. Let's give them one more round of applause. I also want to introduce the newest member of the ASAP team. He's been with us for about 2 months. He's definitely a candidate for Rookie of the Year, and I think he may be MVP material. And I'd like to introduce our communications manager, Matthew Neville. Matthew, would you stand? So in closing, I believe that you learned as much as you could possibly hear tonight about the next steps. But I want to remind you of some of the actions that we can all do. We can all get smarter about prescriptions. Ask your doctors and dentists the right questions. Okay? We can all get safer. Secure your current medications and dispose your old medications. We can all get educated about opioids and addiction and spread the knowledge to everybody you know. We really can become the smartest community in the country, and it starts with each of us. We can get ready to become an ASAP volunteer. Think about the role, the specific role you'd like to play. Later this year, we will be ready for your help. You can get engaged and take advantage of the Project Prevent opportunity. This is a really, really big deal, and we need innovative ideas and programs to create a permanent prevention-focused culture in Bartholomew County. This is a game changer, and we want to get everyone engaged quickly. So finally, I have a few questions. How many of you in this room, with a show of hands, are more aware of this crisis than you were a year ago? How many of you have gained significant knowledge about opioids over the past year? How many of you know someone who is suffering from addiction? How many of you want to do something about it? You know, we're not surprised because I know we are all on the same page. So let me close by saying the obvious. It's not really about the work, although we've obsessed on it tonight. It's about our purpose. And our purpose is to help people in this beautiful community recover from this awful disease and make it a better place to live for all of us. These people are not strangers. They're our sons, they're our daughters, they're our mothers and fathers, they're our neighbors and friends. They are us. I know that we can make a difference, and I believe we will. Our future depends on it. We're ready to go to work. Thanks for being here. Good night.